Hello there everyone, this is Dakota McLean. I'm here today to talk with you about visual impairment and the things that are associated with it, including that of symptoms, causes, some common diseases that are associated with it. Towards the end of this presentation, I'm going to be going over a case study that I was able to find online and discuss a possible exercise prescription I may give to an individual with this kind of prognosis, like this case study. So to start things off, what is a visual impairment? Well, visual impairment is a reduction in vision, usually associated with age, that cannot be corrected by prescription glasses, contact lenses, medicine, or even surgery. The one thing to consider when talking about a visual impairment is the severity of the condition. If someone has a severe condition, then it's going to be a lot harder for them to perform certain tasks than someone who has a low severity of this condition. So it's something to keep in mind. Another thing to think about is when someone's diagnosed with a visual impairment, you want to do everything you can to support them in a positive manner because this is something that's difficult for them to go through. And you want to make sure that you surround them with a solid support group, including their family, peers, coworkers, and everyone else who's associated with them during this time. So, there's some interesting things to consider when talking about visual impairment. One thing is that around 80% of all visual impairments in the world today are avoidable. That's a big difference in regards to, certain things that other people may be diagnosed with. Another thing to consider is that blindness and visual impairment in the US alone costs more than $4 billion in benefits and lost income every year, and is going to continue to rise as more people are diagnosed with visual impairments. So there are some common symptoms that are regarded when thinking about someone with a visual impairment. One thing is that they typically experience things like blurry vision, headaches, glare, poor night vision, double vision, loss of central vision, near or farsightedness, and also cloudy vision. So depending on the condition and diagnosis that they receive in regards to their visual impairment, they may experience some of these symptoms, or they may experience all of these. So it just depends. So there's a number of different visual impairment diseases that occur in the world today, but the top three are cataracts, refractive error, and glaucoma. I personally know two people who have two of these diseases, which is refractive error and glaucoma, and I've seen how it's affected them. They've been able to adapt to how they go about their day and use certain things to help them go throughout their movements and activities of daily living, but they haven't been inhibited from being able to perform things. They've just had to adapt to how they do things. So to start things off, refractive error is when you have an irregular shape of the cornea, lens, or eyeball. So in this case, when we talk about refractive error, you can have someone deal with farsightedness, nearsightedness, cloudy vision, and many other conditions and symptoms that we just talked about in the previous slides. Then when you talk about someone with cataracts, you are dealing with someone who has a treatable condition that occurs with the lens of their eye becoming cloudy or discolored. Typically, when you're talking about this, you're talking about having someone have a clear coating over their eye that's typically gray, and that is something that can be corrected through surgery or an adaptation done to their eye as well as medicine. But in regards to refractive error, it's a much more easy way of dealing with a condition. Last thing we're going to talk about is glaucoma. And glaucoma is a chronic condition characterized by the deterioration of the optic nerve. And this is something that is very specific to this condition, which is when there's pressure buildup. Pressure buildup in the eye can cause pain. Everyone who has glaucoma has it occur over time, and it's only until it gets to its most severe condition is when people get surgery, have other things done to their eyes in order to clear up this condition. It's something that can be occurring without people noticing, just like cataracts. You can have the symptoms occur for years, and until it gets to its most severe point is only when you can really deal with treating it. So there are some common causes in regards to these conditions. The first thing is age. So most people with visual impairments actually experience it when they get older. Because as we get older, some proteins in our eye cells actually start to break down, and it makes it easy for conditions like refractive error, glaucoma, and cataracts all to develop and then cause issues with our eyes. So it is commonly said that people over 50, 65, or 75 have even greater risk of developing certain visual impairments versus those of younger ages, although there are times where people are born with cataracts or glaucoma or refractive error. So in those instances, that's known as childhood visual impairment, and these people deal with that for their lifetime versus when people such as 50-year-olds are diagnosed with glaucoma, they haven't had to deal with it till this time. So there's differences in age and how it affects an individual's life. Another thing to consider is race. So glaucoma itself is one of the leading causes of blindness and visual impairment in the United States. But the most interesting thing about it is it affects most commonly African Americans. So in regards to race, it's very interesting and very concerning if you are someone who is of this race or ethnicity, because then you worry about getting this condition. So doctors will typically stress making sure that they get yearly checkups on their eyes because this is something that could be affecting them down the road. Other things to consider are health-related issues. Individuals who may get in car accidents may have a traumatic brain injury occur, and when this happens, they can actually have visual impairments give rise. And last but not least, we also have socioeconomic statuses, which include um, people who live in lower world countries, third world countries, whatever you want to classify them as. They typically have less access to care as far as treating their conditions. And so if someone lives in an area where their condition can be treated, but they don't have the money, then this can affect the rest of their life and how they go about treating their condition with visual impairments. There are some risk factors to consider when diagnosing someone with visual impairment and dealing with them as far as doctors, exercise specialists, and some things to consider are things like diabetes mellitus, trauma, family history, whether someone in their family typically was diagnosed with a visual impairment prior, or if there's just a history of other diseases such as diabetes, cardiovascular diseases, coronary artery disease. Anything along those lines can also affect the prognosis of an individual with a visual impairment. Other things to consider are age, like we talked about, exposure to sunlight and UV rays. Directly looking into the sun can cause someone to become blind. So there are warnings for looking at the sun, and that's why we wear sunglasses, first of all. And second of all, the rays from the sun can damage our eyes and the cornea, especially where light comes in. So it's important that you take that into effect when considering someone with a visual impairment and how they are affected by sunlight and UV rays in general. Another thing to consider is steroid therapy. Steroid therapy has been used to treat countless different diseases such as cancer and many other things. So if someone has used this in the past, there have been links to it affecting someone's eyes and leading to things like visual impairment. So it is a warning sign and something to consider as well. Last but not least are hyperopia and myopia. These are just things dealing with nearsightedness and farsightedness and the conditions that come with it. So as I stated earlier, there are some treatments for each of these conditions. One is for refractive error. An individual can get corrective lenses. They can have refractive surgery or LASIK, which is something that is well known in the world today. Or they can have reading glasses prescribed to them in different magnifications that help them see either far or nearsighted. So that is one thing that can be done. Another thing is glaucoma. This cannot be cured, but it can be maintained. So when someone is diagnosed with glaucoma, they can have things like eye drops given to them, medicine, various laser procedures, and surgery in the most severe case. But all these things can only maintain their current condition. It can never get rid of it completely because glaucoma will continue to come back over and over and over again. Well, cataracts, on the other hand, there is a surgery that's optional in some cases, and this is where they remove the lens, technically, of your eye, and they place a new artificial lens over it. And basically, that acts as your new lens, and it allows for you to see more clearly and possibly even not have to use glasses anymore. It's not a guarantee, but it's something that they do say is possible. So the case study I have for you today is very long. I'm not going to go into great depth with it. I'm going to talk about it more on the next slide. But I'm just going to say that we have a female here who's 54 years old, who's possibly just been diagnosed with cataract. She's not entirely sure yet, but she's being told that she should take precautions in order for her to go through a process in which she can possibly start treatment and maybe see about getting some help from an exercise professional and how to help her get back into shape and allow for her to reduce possibilities of falling, losing her balance, and possibly push back some of the effects of this cataract disease. So some things I noticed when I read this case study was the fact that she was a 54-year-old female. So we're already in the risk factor where she's over the age of 50 and at risk for having a visual impairment. Then we have the fact that she used to be active but is no longer active, and so getting her back into shape is going to be the hardest thing for her. But getting her into shape and helping her with falling and balance is going to be the most important thing because that strengthens a person's base of support. So if I were going to take everything I learned from that case study, I'd give her the following. I'd tell her that she can work out 3 to 5 days a week at light aerobic activity, and 30-60 minutes. She can do a bike, she can do a treadmill, she can do the rowing machine. All of these things she can do, but at most she needs to make sure that she is supported and has someone nearby possibly to help her if she looks like she's going to fall. The second thing is I would tell her to work out, do weightlifting 2, maybe more days a week, depending on how she's feeling. If she wants to incorporate it with one of the other things, such as aerobic activity or flexibility and balance, she's more than welcome to. But just as a start, I'd like her to do 2 days of strength training and focus on the major muscle groups because that is going to be the most important. And then she can work down to the smaller groups, but we want to start out with the biggest. Last thing is I want her to work out 2 to 3 days a week doing flexibility and balance-oriented exercises. It has been told that Tai Chi and yoga have the best influence on helping someone with a visual impairment work on getting their balance and flexibility, as well as fall prevention to its optimum level. So by doing this, they can then feel better about themselves. They can have a better self-esteem about any worries that they have about falling, and they can, get stronger, feel that they can do more things, and maybe even do more things along with their activities of daily living that they didn't think were possible. Because when they were diagnosed with this to begin with, they thought that, their whole world's over. They're not going to be able to have a life anymore. I think balance and flexibility could ultimately change their life and help them with getting back to where they were before this prognosis. So at the end here, I have a few websites that you can visit. I use these as sources for my presentation, as well just to learn more about visual impairment in general. So follow them. If you have any other questions, the best thing is to just search for eye conditions and then go from there. You can go to a doctor, maybe ask them for more information, or even look up, possible treatments that people have done before. The internet has so many things to offer. These are my references in regards to the meat of my presentation and where I found most of my information from. So you can also go here and use these sources as well to help you with your so that's it. Hopefully you enjoyed it. Thanks again, everyone.